Thank you very much. I am Sawaduga Made. I am from, I am an agent of IRSS from Burkina Faso. And I am the deputy of the Biosafety Officer of the IBC. Now my presentation focus on currently drive research project in Burkina Faso, and we follow the plan first, I want to say that my English, I am not comfortable with English. If something is not clear, you can make sign and I retake. Okay. What the situation of malaria in Burkina Faso? The malaria endemic is even more alarming. The WHO report in 2022 more of 200 million of cases, and most of them are children under 5 years. In Burkina Faso, the estimated cases were 80 million in 2022. Malaria control programs have been based mainly on the use of insecticides and anti-malaria drugs. The strategy had raised great hopes for the eradication of malaria in the past, but are facing numerous difficulties now, such as parasite resistance and vector resistance. It is therefore urgent to develop new vector control strategies that are not based on the use of insecticides in order to prevent a major resurgence of the disease. Current research are in development currently, like the development of new anti-malarial drugs, the development of anti-malarial vaccine. We have IRSS, and the development and the use of various genetic approaches. The project Malaria is a part of the latter approach, using genetically modified mosquitoes to reduce the population of malaria vector mosquitoes and then reduce dramatically malaria transmission. Malaria project evolves according to the following step-by-step development process. First, development of genetically modified male-steering mosquito without impulse, without gene drive. The main of this stage of this research was to acquire scientific knowledge about the mosquito strain. Train the team of research project and develop operational capacities. The second phase focused on development of genetically modified male-based mosquitoes without gene drive. The aim of this phase is to gather more data to guide the development of our final technologies. And the last step will be the development of autonomous mosquito with gene drive. What are the results up to date? For the first one, the phase one, development of genetically modified sterile mosquito without gene drive, this phase is complete. The objectives of this phase were to describe the characteristic and the behavior of male sterile mosquito without gene drive. So the different results of this first activity are: one, characterization of the study sites. So we collect data on the different mosquito in the site, in the study site, and we note that Anopheles colosi and Anopheles gambiae were the main vector in 2 study sites, and in Pala, Anopheles gambiae was the most dominant. We collected also data on meteorological each year and precipitation, and we note that the season extends from May to October, while the dry season runs from November to April. We done activity for stakeholders engagement. Target malaria work with local villagers to jointly define the meaning of key scientific concepts with the aim of fostering productive collaboration between researchers and the local community. On the basis of this collaboration, a common glossary was developed with the communities to ensure commitment and fluent communication with them in a transparent engagement process. Studies also have been carried out to analyze the factors that encourage the local community to contribute to the implementation of the activities. About the result of sterile bees release, the objective of the release were achieved as indicated by the main results summarized below. We have noted that modified mosquitoes were recaptured in swarms, proving that they can participate in swarming activities in the same way as wild mosquitoes. Modified mosquitoes were recaptured in homes, proving that they can behave like wild mosquitoes in the environment. The flight distances and dispersal of the modified mosquito were recorded with an average distance of 136 meters from the point of release. The longevity was measured. The modified mosquito did not survive as long as the unmodified comparators. Molecular analysis of mosquito samples collected during the 20-day daily monitoring did not identify any modified mosquito after the 11th day of recapture. For the second phase, the current stage, this phase focuses on bees male mosquito genetically modified without gene drive. The male bees mosquito represent the current phase of target malaria research in Burkina Faso. Unlike sterile malaria mosquito, this is a fertile male mosquito that is genetically engineered without the use of gene-drive technology to produce predominantly male offspring when mated with wild female. For the implementation of all these research activities, laboratories, insectary activities, stakeholder engagement, and entomological collection were carried out, such as a specialized arthropod containment level 2 insectary is used at the IRSS in Bobo Dioulasso. The arthropod containment level 2 insectary was renovated in 2021. Inspection and certification by the National Agency for Biosafety took place in January 2022. The insectarium team is trained in biosafety and mosquito breeding methods. Authorization has been granted for the import of genetically modified male-based mosquitoes without gene drive in egg form in 2021. Based male mosquito eggs were imported in March 2022. The colony of based male has been reared and is being maintained. Studies have been carried out in a common and in a confined laboratory environment to characterize the strain of optimize its breeding for maintenance and expansion. Here we have a recipe package containing live genetically modified mosquitoes eggs from Italy. The National Biosafety Agency officer were at the airport to inspect the package. Regarding engagement, stakeholders engagement, at all stages of the project, the individual consent of people directly affected by our research and the agreement of the community are obtained before any activities is implemented. The knowledge and expectation of stakeholders are verified in order to keep them informed and improve the implementation of the project activities. Work is aimed at demonstrating that genetic approaches are a potentially credible additional tools in the fight against malaria, complementing existing tools, and creating an environment conducive to their evaluation. Here we have an explanation session for community. Regarding entomology activity, entomological surveys are carried out regularly at project sites. These enable us to assess local wild mosquito population and study their behavior. In addition to gene drive project, other biotechnology projects are also underway in Burkina Faso. At IRSS, we have research focus on transgenic fungi, especially transgenic metarhizium. We are also research on mosquito infected by Wolbachia. Again, we have also the Institute for the Environmental and Agricultural Research, which is doing a lot of work on biotechnology. INERA had already been working on BT cotton for many years, and the results were then disseminated to the general public. It's the same for BT cowpea. There are also projects on potatoes. That are the main activities on gene drive currently done in Burkina Faso. Thank you.